Time being 6 o'clock, I'd like to call the Board of Health meeting to order. Melissa and I are present. Kevin is present remotely, and our, what are you now? Acting health agent, Chris Schultz, is joining us as well. Because there's only 3 of us in the room, I'm actually going to pass over the Pledge of Allegiance for this evening and move straight on to the announcements from the Health Department.
All right, so I wanted to highlight a couple of upcoming events we have. April 2nd, we are going to have a vaccine clinic. It's a Saturday COVID vaccination clinic at the Senior Center from 10 to 4. We will have more details and registration links coming shortly. May 8th through 11th is National Prevention Week. The Health Department will be posting knowledge checks and facts leading up to and throughout the week. And we will be hosting a Talk They Listen event on Wednesday, May 11th at 7:30. The Substance Abuse Mental Health Services Administration's National Substance Use Prevention Campaign helps parents and caregivers start talking with their children early about the dangers of alcohol and other drugs. In addition, we will be hosting a Prepare with Pedro. It's a Read with the Public Health Nurse events that we'll be doing at the library. It's an age-appropriate emergency preparedness program for toddlers and preschoolers. Lindsay's working on the schedule now, and those will be held at the library. And we are also planning on starting up babysitting classes again in the summer. Sign-up information will be sent out via the Constant Contact. As far as clinics, we will be offering blood pressure clinics Thursday, March 31st, April 14th, and April 28th at the Senior Center from 10:30 to 12 in the nursing office off of the dining area. Vaccination clinics for COVID-19, first shot, second shots, and boosters are continuing, and that schedule is available online. So we'll have the April 2nd Saturday event from 10 to 4 at the Senior Center. If anybody is homebound and looking for a first, second, or booster shot, please call our office to schedule. And the links for the booster shots can be found on our website. Also inside Town Hall on the door to the Meyer Conference Room. Also, a couple of reminders for people. We have a Constant Contact sign up. The link can be found on the abingtonma.gov website under the Health Department. We want to remind people that have tested positive for COVID that masking days 6 through 10 after an infection is very important, as you still have the possibility to infect others. The key to that is a well-fitting mask. Reminder also for test distribution, we have test kits at the Health Department. Please call our office for pickup information. And just want to remind people, as always, COVID is still around. We are seeing a slight increase in wastewater sampling across the state. No need to panic at this stage, just please remain vigilant. And don't forget the basics we've been talking about since the beginning: hand washing, social distancing, stay at home if you don't feel well, masking, and vaccination. As far as Abington specific, for positive cases from proctored tests, and that's information we've gotten through Maven, we currently have 9 cases with an average age of 47.49, giving Abington a total case count of 4,568. Test positivity rate is 1.61%, and again, that's only for lab proctored. And that's all we got from the Health Department.
Thank you, Chris. Any of the board have any questions for Chris? No?
I have no questions.
All right. Thank you. All right then, moving on. We have no old business for this meeting. Discussion act items. We have our action items. Body art regulations, microblading. Chris, you want to give some background on this microblading, if you wouldn't mind?
Yeah, so ironically enough, we were going to discuss this at the last meeting and decided to table it until it came up, and the next day after the meeting it came up. So Abington adopted regulation, or at least regulations to allow microblading a couple of years ago, but we don't have anything specific to that discipline. We had a request from someone who has just opened a microblading shop here in Abington to have regulations specific to apprentices. For a practitioner or an apprentice right now under our regs, it's under regular body art, and that requires 1-year apprenticeship along with being able to demonstrate ability in varying degrees of difficulty with tattoos. So microblading doesn't do any of that. What I have for you here is the specific regulation taken from the city of Boston's regs, and it lists the requirement. Basically what it's listing here is the requirements for a practitioner for microblading, and then under the last part states an apprentice goes through 200 hours of training with 30 hours observing procedures and performing at least 50 completed supervised procedures in order to become licensed as a practitioner. So it would just be setting some standards for apprentice that doesn't put an undue burden on them. The woman, she's unfortunately not here tonight, who just opened the shop. She's looking to have a couple of apprentices and was kind of stymied because we don't have any specific regulations for them. So was asked to bring this for your consideration.
Okay. Actually, just random thing I noticed here. Number 1 here, you have a 1 and a 3 next to physiology. Is that referring? Is this supposed to be referencing something, or is it just a typo?
I think those are the courses. I'd have to check.
Okay.
Anatomy and Physiology 1, I would guess it would, maybe it's 1 through 3. I can get some clarification on that.
Okay. Any other questions or discussion with the board on this?
Chris, this is Kevin. I was just wondering, I know you said you got it from Boston. Do other communities in the area have similar type regulations, or is this like the first one in the area, like, neighboring communities?
I didn't do a thorough deep dive, but what the other communities that I looked at didn't have anything specific for microblading. There are 1 or 2 communities that don't allow it. Others, it's just lumped in with body art.
Okay.
As far as I know, there are not a lot of shops specific. In fact, like when Abington, when we passed the regs for microblading, it was the person that was going to be doing it was already a licensed body art practitioner and was adding microblading. So we now have a shop in Abington that specifically does microblading, which is why they were asking to add this.
Okay.
I think that if we, before we decide to take any action on this, we should send this to town council for review. Because if there's limited, if no other town in the area that has something like this, it probably would be of benefit to us to have that checked.
I agree with that, Aaron.
So I'll make a motion then that we send this to town council for review and then bring it back to approve.
I second.
Motion for me on what I just said. Melissa second. Any further discussion? All in favor?
Aye.
Aye.
Opposed? It's unanimous. I don't know why I say opposed, because it's only 3 of us. All right, great. So we'll send those to town council. Lastly, we need to approve the minutes from September 20th, 21, December 6th, 21, December 20th, 21, and February 7th, 2022. Might as well just take these one at a time because we have 4. The first 3 we already reviewed, and we're going to bring back on the 28th. Honestly, I just forgot to put it on the agenda, so we're doing it now. So first is the minutes from September 20th. Do I have any discussion or motion?
Did you get a chance? Who ended up writing these? Did you get a chance to review them?
I was the one that
video?
edited them in review with the video, but I didn't obviously write the whole thing. It's still the pace
Okay.
from before.
I still had a couple of concerns on this one.
Okay.
The rest I'm fine with. So if we can kind of table the vote on this one, then I'll review it.
So you making a motion to table?
Making a motion to table the September 20th.
Okay. I have a motion to table the September 20th minutes. Do I have a second?
Second.
Second from Kevin. Any discussion? All in favor?
Aye.
Opposed? It's unanimous. All right, so we can move on to December 6th. Any discussion or motions from the board?
Motion to approve.
A motion to approve from Melissa. Do I have a second?
Second.
Second from Kevin. Any discussion? All in favor?
Aye.
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 Opposed? Unanimous. Okay. December 20th. Discussion or motions from the board?
I'll make a motion to approve.
Motion to approve from Kevin. Do I have a second?
Second.
Second from Melissa. Any further discussion? All in favor?
Aye.
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 Opposed? Unanimous. All right. Lastly, February 7th. Any discussion from the board?
Motion to approve.
Motion approved from Melissa. Do I have a second? Second from Kevin. All in favor?
Aye.
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 Oh, I'm sorry, further discussion? Now all in favor?
Aye.
Aye. Opposed?
Aye.
Unanimous. All right, so we went through those. So we will come back to you September 20th. We can review those and come back with changes for the next meeting.
Thank you.
Okay. That is the end of our agenda. Do I have a motion to adjourn?
Motion to adjourn.
Motion to adjourn from Melissa. Second from Kevin. All in favor?
Aye.
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 Opposed? It's unanimous. We are adjourned.